Healing crisis. Biomagnetism is clean and safe. It is very beneficial for many health problems and cannot have negative effects if one takes the precautions that we discussed earlier concerning chemotherapy, pacemakers, and pregnancy. However, there is a healing crisis phenomenon that can occur in a minority of cases, less than 10% of the patients that are treated. Healing crises also occur in other treatment techniques, from natural therapies to pharmacological treatments. The healing crises that may occur after biomagnetism treatment are not serious. However, they may pose a temporary inconvenience for the patient. They may include fever, cough, nasal congestion, dizziness, headache, abdominal or joint pain, vomiting, diarrhea, weakness, skin rashes, etc. The therapist should inform the patient about the possibility of a healing crisis. Thus, if a healing crisis finally happens, which is unusual, the patient will be temporarily uncomfortable but not alarmed. The main cause of a healing crisis is that some microorganisms, such as bacteria, are destroyed as a result of the biomagnetism session. When destroyed, the body has to expel and purge all the elements that constituted these microorganisms, and it can remove them mainly through feces, urine, sweat, and lymph. The discomfort of a healing crisis can happen during this removal process and before the body has already been able to completely remove all these waste products and toxins. If a healing crisis occurs, it is desirable that the patient drinks plenty of water, that he even eats more fiber, or takes a steam bath. This way he will manage to drain and remove more quickly all the toxins from his body. The patient should also rest both physically and mentally during the crisis. A healing crisis rarely starts to occur during the biomagnetism session. Sometimes it begins during the hours following the session, and it very seldom does it after 48 hours of the session. And it usually does not last more than a few hours or a few days at most. In any case, a healing crisis is temporary. It is a purge detoxifying the body that can be uncomfortable for the patient. But once it has already passed, the patient feels a great relief, a clear sign that the body has been cleaned, the therapy session has been successful, and the patient is cured or in the process of healing. However, this does not mean at all that there should necessarily occur a healing crisis to certify the success of the therapy session.